Okay, I think we're all present and correct. I think there's standing room only. There's a few spare seats if you're willing to kind of shuffle in and move people out of the way. If not, you're welcome to stand. So my name's Sue Nyombe and I'm your chair for this session. I'd like to introduce Dr. Jessica Heron, who is the Director for Action on Postpartum Psychosis, and Dr. Sally Wilson, who's the Training Coordinator for Action on Postpartum Psychosis. And I'm not going to say anything else about you because I'll probably get it wrong. So you can say that for yourself. There you go.
Okay, thank you, Sue, and good afternoon, everyone. As Sue said, my name is Sally Wilson, and I'm the Training Coordinator for Action on Postpartum Psychosis. So I experienced postpartum psychosis in 2015. So I'm just here to talk to you today a little bit about what happened to me. And then myself and Jess are just going to talk about the workforce training that we offer and what we feel midwives should know really about postpartum psychosis. So just before I talk to you about my story, I just want to acknowledge that people's experiences of perinatal mental health can be very different depending on their background, their previous mental health and support network. So this is just my perspective and a brief insight into what happened to me. So I'm just going to start really by showing you notes from my iPad. So when I was ill, I used to write myself notes just to work out what was happening to me, because I couldn't remember sometimes. So this is just an example of some of the things I would write before I went into a session of electroconvulsive therapy, or ECT, which I'll explain a little bit more about later on. So this is my iPad. I'm married to Jamie. We have Ella. She is 10 months old. I've had 10 sessions of ECT. That's a general anaesthetic and electrodes to induce a fit. I've been diagnosed with postpartum psychosis. I believe I've killed Ella and I'm living in an afterlife. So when I used to wake up from the ECT sessions, I had no memory of who I was and what had happened to me for quite a few hours afterwards. So the kind nurses would keep my iPad safe for me and tell me to look on my iPad so I could remind myself what was going on. This was a good idea until I realised I couldn't remember the pin to get into my iPad, so I learnt for next time to write it on my hand. So how did it all get to this point? So I actually grew up in Birmingham, and now I live in North Wales with my husband Jamie and my daughter Ella, who's just turned 4. My pregnancy was great. I felt quite healthy and carried on exercising and working quite late into my pregnancy. The birth was tough as I developed preeclampsia and an infection, so I was eventually induced. And Ella was born by emergency C-section under general anaesthetic at 6:23 on the Wednesday morning. So I woke up from the anaesthetic quite confused. This is quite normal, obviously, after a general anaesthetic, but the confusion got worse and it was quite prolonged. I couldn't quite work out what had happened to me. I had no concept of time. So, for example, I would be trying to breastfeed Ella and I had no real concept of how long I'd been doing it for each time. And I couldn't really work out where she'd come from. So I had various physical tests, such as CT scan on the brain for suspected stroke from preeclampsia, but they were all negative. The confusion got worse, and for some reason, my brain was on overdrive. I was quite manic. I started to get quite paranoid and hearing things loudly in my head, such as babies crying, which is not uncommon on a labour ward. But I eventually started to hear and see things that weren't really there, such as shadows on the wall and flashing blue and yellow lights. And I vividly remember standing at the midwife station and hearing the midwives talking about me and my life, but that didn't happen in real life. So a few days after Ella was born, I was awake for the whole night and I just couldn't sleep. And a lovely midwife stayed with me throughout the night. So I'm just going to read you a few of my medical notes just to give you a flavour of what was going on through that time. So this was Saturday night, 11:45 p.m. Sally has given me concern. She is questioning the situation she is in and she's saying, what is happening to me? What's wrong with me? I sit with Sally for 2 hours and she continues to feel anxious. She is worried about the baby's welfare. Sally asks where Jamie is. He is at home asleep. 3 a.m. in the room is Sally after answering the call bell. I've only just left the room. Sally seems agitated. She turns to me every now and again and asks what's happening. 6:30 a.m, Sally has not slept and is becoming more anxious. The site liaison team have been informed as Sally is concerned she's harmed Ella and someone else and can hear Jamie crying, who's not here. 10:30 a.m. on the Sunday, Sally is confused, anxious and paranoid. She's asking, am I on the postnatal ward? Have I hurt my baby? Is this my baby? Have I killed someone? So that day, 4 days after Ella was born, I had a psychotic episode on the postnatal ward where I collapsed and I saw the midwives taking our baby daughter away to be resuscitated. I suddenly had a realisation about what I'd done. I 100% believed that I'd harmed my daughter. So I was lifted off the floor onto the bed and eventually came round, and my whole reality and perception of the world had changed. So in reality, our daughter was fine and she was being looked after by the lovely midwives, and eventually she came back into the room and I just didn't believe she was mine. So at that point, I was admitted to a general psychiatric ward and diagnosed with postpartum psychosis. And Ella went home with Jamie and I was monitored for a few weeks on the ward. But I still didn't believe she was mine when I saw her. So I was discharged from the psychiatric unit and monitored at home by the community mental health team and prescribed various antipsychotics, anti-anxiety medication and antidepressants. And Jamie took time off work to help with me and Ella. So day-to-day life was spent going through the motions of feeding and nappy changing, together with appointments from midwives, psychiatrists, mental health teams, health visitors, GPs, and clinical psychologists. So I still believed I was living in an afterlife, and my friends and family became quite stranger-like. So I still was quite paranoid, and I had delusions, and I just didn't quite believe that I was ill, and I just couldn't make sense of my world. So a lot of my time was spent trying to work out what was going on. So eventually I came round to the idea that I might be ill, but I started to think that there was no way out of it and that I wasn't going to get better. So I began to get severely depressed, which can happen sometimes after psychosis. So I had very intrusive thoughts about my daughter and myself, and I had no positive feelings really towards anyone, including my daughter. So I had no control over these thoughts. I would constantly flit from desperately wanting to get better to just there being no way out and to try and end things. I refused to go back into the general psychiatric ward because I was quite scared of it. So I was monitored every day at home and wasn't allowed to be by myself. So things got so bad that Jamie was forced to push for more treatment. So with the help of him and a secondary opinion psychiatry service in Cardiff and my team up in North Wales, I started electroconvulsive therapy as an outpatient 9 months after I gave birth to Ella. So I had 10 sessions over 5 weeks, and this is where, after a general anaesthetic, you have a muscle relaxant and an electric shock on the brain to induce a fit. The memories of that period of treatment are still quite traumatic even now, and it's something that I wouldn't want to go through again, but it quite literally saved my life. So this is a picture of the Alpe d'Huez in France, and it'll make a little bit more sense later on. But basically, it's just to represent that it's been quite a long road to recovery. So after the ECT, I had quite a lot of memory loss and some residual symptoms of psychosis and depression. But gradually over time, those symptoms disappeared. So I spent quite a lot of time dealing with the shock of what happened. So how could someone like me have ended up with a severe mental illness? And this wasn't how having a baby was supposed to be. I also had to work a lot on my confidence in life in general, but also with my relationship with my family, friends, and Ella. So for some women, the bond with their baby is very strong, but for others it can be quite disruptive. And I wasn't there physically in the first few weeks when Ella was born, and I probably wasn't there emotionally for the first year really after she was born. So that's quite hard, and it makes me quite feel sad and quite guilty sometimes. And I spent a lot of time worrying about what had happened and whether that would impact upon Ella. But I look at her now and I see how happy and engaged she is, and I don't worry so much about that anymore. So I worked through a lot of these issues after my initial treatment with a clinical psychologist, which I was really lucky to find. And I also found the charity Action on Postpartum Psychosis, who support women and their families going through BP, postpartum psychosis. So when I was ill, I was able to talk to someone about postpartum psychosis, and a woman that had actually been through it herself, and that really helped me with my recovery and just gave me hope that I would get better. Then 2 years after I gave birth, my lovely friend entered me into a 3K open water lake swim to raise money for APP. And I also trained as a peer supporter, so now I help other women and families going through postpartum psychosis now. And I've recently just been employed by APP to help develop and deliver training days to health professionals. So it's taken me the best part of 4 years really to recover from what happened, and I still think about it most days. I think about how horrific it was and how sad it makes me feel. But I also think about how lucky I am and how lucky I was able to access the right treatment and how fortunate I was to have such strong networks in place. I appreciate that is not always the case. And it's because of all that I'm here, healthy, and doing the things that I love with my family. And that's including bottom left there, you can see me, Ella and Jamie, having cycled up the outdoors at the top there. I didn't tow her, Jamie towed her in the trailer. So I'd just like to end this little bit of our talk really by saying thank you for taking the time to listen to me. Without people like yourselves who are passionate about improving services for women and their families, I probably wouldn't be standing here today. So thank you. So I'm just going to hand you over to Jess, who's going to talk about a little bit more about the charity. So that's your clicker.
Okay, I'm Jess Heron. I'm Director of Action on Postpartum Psychosis, and by background I'm a Senior Research Fellow in Perinatal Psychiatry at Birmingham University. And we've been doing different types of studies into postpartum psychosis for around the last 20 years. Postpartum psychosis, it's a severe, incredibly frightening form of postnatal illness. It occurs often out of the blue in the days following childbirth and affects about 1 to 2 in every 1,000 deliveries. It has to be regarded as a psychiatric emergency. Confusion, delusions, hallucinations, and unusual behaviour can start very mildly at first, but then tend to escalate very rapidly at a very vulnerable time for women and babies. Delays in treatment, we know, cause risk to the safety of the mum and the newborn. They cause longer and more severe episodes, and they impact on a woman's recovery. So it's really important when we're thinking about care pathways that we explicitly take into account the needs of women and families affected by postpartum psychosis. The care pathways need to be different from postnatal depression. It onsets at a different time. It differs in terms of the risk factors, the kind of symptoms, the timing of onset, the severity, the type of risk to mother and baby. It also differs in the kind of treatments needed and in the illness course and the outcomes that can be expected. So it's really important that we don't have a postnatal depression pathway that we expect to just work for women and families with postpartum psychosis.
Yeah, hold your mic up a bit.
So why in Action on Postpartum Psychosis we've been trying to look at training. So health professionals, including midwives, report really lacking confidence in identifying and managing women with postpartum psychosis. They report feelings of fear when dealing with women, and that's not surprising. Postpartum psychosis, women who are ill, it's incredibly severe. It can be incredibly scary. Health professionals report that they lack knowledge, and women report that they didn't feel their health professionals were knowledgeable enough as well. Postpartum psychosis, we're getting there now, but it hasn't been traditionally taken into account when we're planning services. But what we know is that suicide is a leading cause of mums dying, and around half of cases of suicide are in women that have suffered from postpartum psychosis. One really positive thing is when we get care right for these women, we get them through, we can make sure they're not traumatised by the kind of services that we deliver, we know that it's an illness that's really treatable. Clinical outcomes are really good. So APP are doing a campaign this year to see if we can introduce more training for midwives and to try and make aspects of perinatal mental health training mandatory. What we do know is when there are tragedies, midwives are often criticised for the care that they've been that's been delivered, but midwives aren't allowed any time for training in perinatal mental health, and this situation is not good for women, it's not good for health professionals. So I'll just tell you a little bit about APP. We're run by academics, women with lived experience and clinicians. We're hosted by Birmingham and Cardiff University. We've got over 1,000 women members throughout the country, and we've been making a great change in postpartum psychosis nationally. We offer peer support, which might be online, email, face-to-face groups, cafe groups. We develop information. So there's some guides over there, but I just wanted to draw your attention to this one, which is a really useful guide for midwives, which is planning care for women who've had a previous bipolar disorder or psychosis who will be at higher risk of postpartum psychosis. So we're here today to talk about the kind of training that we've developed. At the moment we offer two kinds of training. One is lived experience talks delivered by our regional representatives with lived experience. And we also offer a full day workforce training, which is delivered by women with lived experience, but also by leading academic researchers and clinicians. We set about, when we were thinking about the training, to develop something that was specialising in postpartum psychosis, but also talking about the management of bipolar disorder and psychosis in the perinatal period. That it was aimed at all frontline health professionals. It's co-produced, it's co-delivered, it's designed to meet the competency framework of a variety of health professionals. We look in detail at symptoms of postpartum psychosis, the early signs. For midwives particularly, understanding the range and the kinds of early signs that women can experience is really important. If you head to our website, which is available on one of the leaflets, you'll see there's a list of the types of early symptoms that women experience, developed from looking at the early periods of about 200 women who experience postpartum psychosis. We wanted the training to challenge stigmas, to try and increase understanding of the context and the family life in which postpartum psychosis is experienced, to try and help health professionals to understand the importance of going the extra mile, of the importance of trying to consider the very best care for women and families. So I'm just going to hand over to Sally again, who's been conducting our first evaluation of the training to date.
Okay, so I'm just going to talk a little bit, very briefly, because I'm aware of time, just about the evaluation to date. So to date, we've had 191 health professionals attending 10 different workforce training days over the last kind of couple of years. And that's very multidisciplinary days, so including midwives, psychologists, perinatal mental health teams. And the evaluations consisted of very much about the content of the day, but also about the impact of training and the training on clinical practice. Okay, so I'm just going to show you a couple of things in terms of the evaluation. So you can see here 100% of the attendees rated it good or excellent, and quoting things like, I think the training is essential for midwives, health visitors and social workers. 100% agreed that it would change their practice, with approximately 70% saying that it changed their practice a lot. Let's go through. And then things like increasing their knowledge of postpartum psychosis, and also increasing confidence and empathy when working with women and their families. I'll just flip through these. The thing that I want to highlight about this evaluation was, one of the questions was, what did you enjoy most about the day? And you can see here that about 124 out of the 191 really appreciated the lived experience side of things. So we have someone telling this, a woman telling her story, but also she tends to facilitate the day as well, along with the clinicians and academics. And you can see here, those are the things that people really enjoyed throughout the day. We've had some really great feedback as well. So for example, you can read along the bottom here that the first-hand lived experience was invaluable. They gave a true insight into which I've never had before. So just highlighting the real importance of that kind of co-facilitation with lived experience and the clinicians and academics as well. And then just another question, free box text, in terms of what you might do differently as a result of the one-day training. So a lot of people talked about taking more time with patients, if possible, and not necessarily taking a snapshot of that's what's happening at that time, to think about what's surrounding them in terms of family and support networks, and looking at a more kind of individualised approach. And then being able to recognise early signs and symptoms, and then looking at networking and working more multidisciplinary. And again, just looking at some of the quotes you can see here, I will view PP more holistically as someone's life with their family, not just a snapshot of illness, but someone who can and will recover. So really it just highlights the kind of importance of that co-facilitation and co-production and of lived experience and clinician and academics within kind of training, workforce training. So we're gonna leave you really with a video, a short film that Action on Postpartum Psychosis put together, just to address some of the stigma surrounding postpartum psychosis and the mother and baby relationship.
When my baby was first born, I felt immediately bonded to her. I think she was just so tiny and precious, and that feeling continued even when I became ill. So when I was ill, I felt that she was very special and she was going to have a really important part to play in the world. But as the illness increased, that began to become sort of more detached from reality. But even when I was in hospital, she could come and visit me every day, and she still felt very much part of my life.
When I was ill, I remember being very protective about my baby, and in fact I was first sectioned voluntarily when I put her in a cupboard to protect her from the family dog. So all the way through I remember wanting to protect her and feeling a really close and very huge bond of love to her.
When Jessica was born, I was unable to bond with her at all. And I was very irrational and said a lot of strange things to the midwife and the health visitor. I used to say things like, the baby's really angry with me and the baby hates me. She knows I'm not able to bond with her, and she's aware of it. I was also very confused all the time. Sometimes I'd come down and almost forget I'd had her. She'd be on the setting, I'd be shocked, oh, I've had a baby. And just things like making up feeds I found very difficult, because my mind was racing that much. I couldn't trust myself to make up feeds and measure out dried milk. And really I had no bond at all. I didn't want to hurt Jessica, but I totally rejected her. I would have been quite happy should someone have taken her away. In my deluded, irrational state of mind, I thought if the baby goes, I'll feel better, I'll be like I was before the birth, and that wasn't the case. But in my rational thinking at that time, that's why I was saying to people, please take her away, I can't do this.
I just felt completely rootless when I was separated from her. That's like a week that doesn't exist, and something that, in a way, I still feel. Photographs were taken of her during the week I didn't have her, and I still find those quite painful to look at. I mean, I would rather, missing that bit of her life was much more damaging. I didn't need to know what she looked like. I just needed her back?
Well, the relationship at the time, in the midst of the illness, was like I say, an afterthought. Really, she was there. I could do certain things, but I couldn't do everything for her. I just wasn't capable. You know, there was more important things to be doing than looking after my baby. My mind was controlling me, and you know, she was not the top of the list.
I was fiercely protective of him at that time, but I couldn't focus. I needed help with the practical things. The main focus was survival myself. Yeah, definitely. But further on, into the depression stage, I was like a zombie, emotionless. I couldn't go out of the house. So obviously bonding was, again, it was really difficult, very, very difficult. And it's really hard for a mother to admit that, the guilt that you feel for feeling that way, because mums aren't supposed to feel that way.
My relationship now with my daughter is great, actually. She's really good fun. She's 8 years old. It's a really lovely age. We make each other laugh. It's good fun.
My daughter's now 7 and we just have a great relationship. I feel we have a very open relationship and we can talk about mental health. She knows that Mummy was poorly when she was born, but we just have a really normal, fun mother and daughter time. We can joke together, laugh together. She tells me all about her school day and it just feels very normal.
She was totally unaware of it, but it was something that we built into the family narrative when she was old enough to talk about it initially as this rather bizarre experience of how her early life had been. And later, as she had the knowledge and the biological expertise to want to know about it, much more about the condition, which I only wish I'd heard of before I'd had it.
You know, you do miss that time, you know, those very first few weeks and months are very hard to remember. And I think now I'm trying to make up for that and give her everything, which is probably wrong as well.
Now, we've got such a close bond. It's very, very special. I think it happens naturally anyway. It's just, having been so ill, it just took a lot longer. But it's there. It's, yeah, more so in a way because of the tough start we had.
No, well, I would say from Jess reaching about 8 months onwards, when the postpartum psychosis started to turn around, there was you know, improvement in the illness. I started to notice Jess's funny ways, how cute she was, and I really gradually bonded with her. It wasn't something overnight that I was so ill and suddenly felt better. It was very gradual. And I enjoyed all her little funny, cute ways, spending time alone with her, buying things for her. And I would say now I have a really close bond, a really close relationship with her. I'm immensely proud of her. I remember at the time of the illness that my mum said to me one day that little baby will make you proud. And in the throes of illness, I said, no, I'll never enjoy this. I'll never be able to do it. And recently at a Christmas concert at school, she stood up on her own and sang a solo, and I just cried, and I couldn't have been prouder of her. And yes, I go through the normal ups and downs of parenthood, but never do I regret having her now. She's the love of my life.